Diagnosis. Again, coming back to the three conditions, let's go to the first condition. If you have chest pain, whether it is typical as described in the previous section or any kind of chest discomfort, the easiest way to diagnose if you're having heart attack is an EKG, which is a graph of the electrical rhythm of a heart, which would show if you have any heart attack. Sometimes EKG may miss heart attacks, so it is followed up by doing a blood test where they would decide, which would determine if you're having an ongoing heart attack. Many times you may not have a heart attack, but the pain could be coming from the heart itself, and then it's called angina. So your cardiologist would do an echocardiogram to see if there's any weakness in any particular area of the heart, or they may put you on a treadmill, do a test called stress test. If you have conditions for your back or knee pain, which prevents you from doing a stress test, there are other ways of doing stress tests to determine if the pain is coming from the heart. If he decides you're having an ongoing heart attack, he would go directly and do a procedure called angiogram, where he would inject a dye into the circulation of the heart and see if there is any blockage or clot in the heart that can be treated immediately. The second condition we would talk about is heart failure. If you're having difficulty breathing or inability to lie flat or swelling of your legs, if you see a cardiologist, he would immediately do an echocardiogram to see if there's any weakness in the heart muscle or any valves that are not working properly that is causing this condition. And depending on what it is, they may immediately treat you, first looking for the cause for the weakness of the heart, and subsequently give medications that help you breathe better and live longer. The third condition is atrial fibrillation. As described before, it usually comes as palpitation. This can be easily diagnosed with something called the electrocardiogram or the EKG. If, for example, if EKG is normal, but you get palpitations once in a while, they may place something called a loop recorder or even monitor to see if you have irregular heart rhythm that comes and goes. Once that is diagnosed, they can institute treatment not only to decrease the heartbeat, but also to prevent stroke.